Hi, I'm Dr. Amy Brenner, and today I wanted to talk to you about something you may not have heard about when you went through menopause. I haven't gone through menopause yet, but I kind of relate it to after I had a baby. Nobody told me that some of these changes were going to happen to my body. I didn't realize after I had a baby what was going to happen to my breast, what was going to happen to my skin. Now that I've gone through it, certainly that's something I know. But something I hear a lot from women who have already gone through menopause is I didn't know this was going to happen to my vagina. So today I want to talk to some of the things that happen to the vagina when you go through menopause and you don't have hormones around. So the tissue in the vulva, the outside lips, the inside of the vagina are very hormonally sensitive. So what that means is hormones such as estrogen and testosterone really affect that tissue. So when you go many years without having estrogen and testosterone around, that tissue becomes atrophic. Now that's the medical term I like to use. Sometimes people don't know what that term means, so I'm not trying to downplay it, but people do understand when I use the word shriveled up. So when you go through menopause and after many years with hormones not being around, the tissue of the vulva and the vagina becomes pale. There's lack of blood flow. Sometimes it can constrict. And so what this can do for women is it can cause dryness, it can cause just pain with intercourse, and it can even get so severe that it can lead to a lot of urinary tract issues or even just pain on a daily basis. The good news is we have a lot of options to talk about that. The traditional therapy is just replacing lost hormones, and that can either be done just locally in the vagina and vulva or just systemically with hormones going through your whole body. Now that topic is for a whole other discussion. I'm not going to talk about systemic hormone therapy, but the local therapy just works on the vaginal and vulvar tissue, and certainly that's one option. The downside about that is it took many years with hormones declining or without hormones to get to that point. So just replacing local hormones alone is going to take a long time to get back to that pre-hormonal state. So the other things we have in our practice that can complement local estrogen or testosterone therapy is something called a CO2 laser or the intima vaginal laser, and PRP, or something you may have heard as the O shot, or even wave therapy. All three of these therapies work by getting to the end result by regenerating new tissue. They just get there in a little different way. So the laser treatment, you may have heard it called the Mona Lisa, the Femi wave, the Diva. In our practice, we use a certain brand called the Intima laser, and they're all the same wavelength. And so what this does is it's the same laser that I've been using in our practice for people's face. The laser makes tiny little microscopic holes in the tissue, and then when your body heals, it regenerates new tissue. So when we make those tiny little microscopic holes in the vagina, when it heals, it regenerates younger, more youthful tissue. The O shot, again, gets the same end result by regenerating new tissue, except it's using platelet-rich plasma or your own blood that has its own growth factors in it in a concentrated part of your blood. And when we inject it back into the vagina and the vulva, it regenerates new tissue. The wave therapy is a completely non-invasive device where there's no microscopic holes in the tissue from the laser. There's no needles or no blood drawn, where we actually rub this wand over the vulva and vagina, and it emits low intensity shock wave therapy. This procedure has been studied extensively in men, and it helps regenerate blood flow, regenerate nerves, and regenerate tissue. The question you may ask is, well, those all sound great. Which one should I do? And really, just depending on the individual circumstances and how severe the atrophy is, or even how quickly somebody wants to get results, that's where an individual consultation comes into place. But I just wanted to give you a high level overview of some of the things you may not have thought that happen as your body kind of loses hormones and you go through menopause.